And at this time, we are going to do two renditions. Deara Sweeney, and she's going to be singing a song, Smile, by Kirk Franklin. And then we have Dr. Laurel Bradley, and she will be leading us in praise and worship. Sit back, relax, and be entertained by these two angels on earth. Thank you.
Today's a new day, but there is no sunshine. Nothing but clouds, and it's dark in my heart, and it feels like a cold night. Today's a new day, but tell me, where are my blue skies? Where is the love and the joy that you promised me? Tell me it's alright. I almost gave up, but a power that I can't explain fell from heaven like a shower now. I smile, even though I hurt, see I smile. I know God is working, so I smile. Even though I've been here for a while, I smile, smile. It's so hard to look up when you've been down. Sure would hate to see you give up now. You look so much better when you smile. Today's a new day, but there is no sunshine. Nothing but clouds, and it's dark in my heart, and it feels like a cold night. Today's a new day, but tell me, where are my blue skies? Where is the love and the joy that you promised me? Tell me it's alright. I almost gave up, but a power that I can't explain fell from heaven like a shower now. I smile, even though I hurt, see I smile. I know God is working, so I smile. Even though I've been here for a while, I smile, smile. It's so hard to look up when you've been down. Sure would hate to see you give up now. You look so much better when you smile. Smile for me. Can you just smile for me? Smile for me. Can you just smile for me? Oh, oh, oh. You look so much better when you, oh, oh, oh. You look so much better when you, oh, oh, oh. You look so much better when you, oh, oh, oh. You look so much better when you smile. You look so much better when you, oh, oh, oh. You look so much better when you, oh, oh, oh. You look so much better when you, oh, oh, oh. You look so much better when you smile. I almost gave up, but a power that I can't explain fell from heaven like a shower now. Right now, I smile, even though I hurt, see I smile. I know God is working, so I smile. Even though I've been here for a while, I smile, smile. It's so hard to look up when you've been down. Sure would hate to see you give up now. You look so much better when you smile. 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 So smile, so smile. You look so much better when you smile. Oh, you look so much better when you smile. You look so much better when you smile. So smile, so smile. Thank you.
Testing. You all hear me? She said that you look so much better when you smile. How many believe that? How many honestly believe that? How many honestly believe that? Can we really say that we look so much better when we smile? Amen? Amen. You know, I just want to kind of piggyback on her song and have some audience participation, because we're going to do praise and worship. I see here that some of the lectures are going to be about love, so we'll have a real quick song about love, and then Dr. Lana had the pleasure of a couple of occasions sharing a prayer with me about light. So we're going to end with talking about the light and everything that is within us. And there's going to be real quick songs, because I only have a few minutes to do that. But let's just kind of, you look so much better when you, 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 you look so much better when you smile. Amen. So a real quick song that we're going to teach you all. And it's talking about I love you. Who here actually can identify with love? It's a universal language. Amen? Everybody here? Amen. So we're going to talk about I love you. Now, I know that we're a non-denominational, non-everything, but everybody can identify with love. And I love the Lord, and I have to put that out there. So this is, I will play this one. Everybody here will say, amen. So the song is real simple, and you can think about that higher power and the God that you serve, or even someone you love, and just kind of make it very personal. And just listen to it, and it's going to be a real quick call and response, okay? So it goes, I love you forever. I love you forever. I love you forever, Lord. You can sing it. I love you forever. I love you forever. I love you forever, Lord. I'll sing it one more time. I love you forever. I love you forever. I love you forever, Lord. Let me sing it now. Sound good? Yes. Yes. Forever, Lord. I worship forever. I worship forever. I worship forever, Lord. You can sing. I worship forever. Yes, you sound good. I worship forever. Yes. I worship forever. Let's see, I love you forever. I love you forever. I love you forever. I love you forever, Lord. Sing it again. I love you forever. Sound good? Yes. Forever. I love you forever, Lord. Amen. You all probably know it's called This Little Light of Mine. Do you know that one, Dr. Rana? Thank you. So everybody that knows, I'm going to sing real quickly and then we're going to move on to the program. This little light of mine, I'm going to let it shine. Oh, this little light of mine, I'm going to let it shine. This little light of mine, yeah, I'm gonna let it shine, let it shine, let it shine, let it shine. One more time, say, this little light of mine, I'm
Good morning. Thank you for coming today. It's going to be an awesome packed day. First, let me introduce myself. My name is Lisa Fager-Bediako with the Congressional Black Caucus Foundation. We've been a partner with Howard University Hospital since the inception of the conference. It's our 4th year. Yay! So I'd like to welcome everyone to the 4th Annual International Conference on Stigma. I'd like to say good morning, good afternoon, good evening, wherever you are via live stream. So thank you for coming and tuning in on the web via whocanyouTell.org and following us on Twitter. So I know we have a lot of people who are on Twitter and Facebook, and we can be found in both places at Who Can You Tell. We're using the hashtag HIV Stigma today, so I see a lot of people taking pictures and photos. Please hashtag your photos or also post them on our Twitter page at Who Can You Tell. I will be with you all day helping to guide us through a better understanding of what HIV stigma is, its impact, and what we can do to end it. HIV-related stigma is one of the biggest barriers to HIV prevention and treatment. UNAIDS defines HIV-related stigma and discrimination as a process of devaluation of people either living with or associated with HIV and AIDS. Discrimination follows stigma and is the unfair and unjust treatment of an individual based on his or her real or perceived HIV status. We have guests and institutions tuning in to view us online at whocanyouTell.org from all over the world, including Canada, Peru, Mexico, Uganda, India, Ethiopia, Puerto Rico, and of course across the United States. Yay! Yes, and just to add, in our past years, we've had over 50 countries view us online, and so we expect that today too. Fighting stigma requires an extensive partnership with every segment of the community, and that is what has made this conference a success for the past 4 years. To increase community involvement and awareness about HIV-related stigma, we ask young people to participate in posters and poem contests. So I want to give a special thank you to Restart Educational Foundation and the Promising Futures for their continued support of this activity. We had many new entries this year. Both local and international schools participated. Please take time during the day in the lobby. You'll see the posters and the poems surrounding the vendor area. Please take a look while we're at lunch or when you take a break, because we want to definitely keep supporting that activity. So let's go over some housekeeping. Okay. Everyone should have received the program book when you arrived. If you have not, they can be found in the lobby. Inside that program book is the agenda and the bios of each presenter. Please do not forget to fill out the evaluation forms. This is our 4th year and feedback is always very valuable. Please turn off your cell phones, or, well, don't turn them off because we want you to tweet, but put them on vibrate or silence. The bathrooms are located right out this door, easy to find, on this floor. We have coffee available in the back of the lobby floor area. Please check out our wonderful vendors as you head to the restroom or get some coffee. This year's vendors include the Howard University Clinic and Ryan White Part C, the Metropolitan Wellness Center, and there's a host of others. Please visit them. And lastly, we will be giving away 3 gift cards as door prizes throughout the day. One after lunch for $100, and one after plenary 2 for $100, and at the end of the day, $250. So in order to receive that, though, you need to be here. And so, however, we have those, we have them separated. So if you're not going to be here in the evening, make sure you do the morning gift card pull and, you know, so forth and so on. But you're going to have to be here if you want that big money. Okay. And Continuing medical education credits. We are pleased to announce that we were able to offer 6.2 CME credits to medical professionals for this conference. The breakdown of the credits is available in the program book. In order to ensure you receive credits for the session you attend, please visit the CME registration table in the lobby to pick up your CME registration packet. The fee for CME registration is $20 for physicians, $10 for all other health professionals. And please note, none of our speakers or moderators have any financial interest or other relationships with any commercial products or providers of commercial services discussed within this conference. Also, I want to announce there's free HIV testing available today. The mobile unit is outside the community education group, and they're also testing in the lower level of this building in the basement. Welcome to what is going to be an action-packed day of learning, interacting, and building with dynamic speakers from all over the country and globe. Again, I want to just reiterate the bios are in the program book in case you missed that. I want to thank Howard University for hosting such an important topic in honor of World AIDS Day, which is December 1st. We are pleased to have Ms. Jeannie White-Ginder as our morning keynote speaker. As the mother of Ryan White, she has done tremendous advocacy work for HIV stigma, and we are excited to have her share her and Ryan's story. And I remember so vividly as a teenager his story. I really do. And so I can't wait for you to speak. So to get us started this morning, please welcome Ms. Terry Thompson from Howard University Hospital. Ms. Thompson is the government affairs official. Is she here? Okay, we're going to skip Terry. So now we'd like to introduce, that puts us back on track. Okay. Now we'd like to introduce Dr. Rafael Mazin, who will bring us greetings from the international community. Dr. Mazin is the Senior Advisor of HIV/STI Prevention at Pan American Health Organization, Regional Office of the World Health Organization. Please welcome Dr. Mazin.
You can't imagine what an honor it is for me to be the person opening this important event, this international conference on HIV stigma, and to make a short presentation. This is not a lecture, it's just a sharing of my reflections and thoughts about the importance of the attitudes of healthcare providers, the healthcare force, and the caregivers in the healing process. A smile, a comforting word, or a loving touch makes a big difference. A loving touch elicits the power of healing we all have inside. In the absence of this comforting touch, the comforting smile, the comforting word, the healing process is hampered. And this is why I want to make reference to some attitudes we frequently still see in healthcare services. And I refer to them as the 4 evil eyes. The first evil eye is indifference. And indifference is expressed in those moments in which there is very limited contact with a person, or the person is treated with hesitation and delay, or the service is refused or denied just because of her health condition, her sexual orientation, her gender identity, her lack to produce a credit card, an insurance ID in the moment she's requested for, and therefore the hostility and the degrading treatment replace the loving touch and the comforting words the person in stress, in distress needs at that very moment. The insult is the second evil eye, when the person is treated with expletives, with slurs, or is lectured about her evil or deviated lifestyle, or is called as bearer of an abomination. This is absolutely unacceptable as a standard of care. Indignity is the third evil eye that occurs when a person in private or in public is demeaned, is humiliated, he is blamed for her condition, and is exposed to scorn because of who she is or the condition she has. And finally, and not least important, is injury. When we are injury to insult, then the standard of care is absolutely unacceptable. And this occurs when the person is treated with verbal, emotional, or even physical violence, is submitted to treatments that are equivalent to torture. She's submitted to the so-called reparative therapies that are absolutely useless and degrading. And she is submitted also to what I call spiritual damage. Her spiritual health is touched in a negative manner because she's told that she is unworthy of the love of a superior being and doesn't deserve salvation. This is spiritual terrorism. We need to act, and the avenues for action is improving the collection of information on when this happens and what are the factors that trigger it. There are many factors. We have analyzed some of them. We cannot yet presume that they are really associated to cause and effect, but we can tell that, for example, the insufficient or poor training of healthcare providers and the healthcare teams is one of the elements that is at the origin, at the basis of this bad treatment. We need to sensitize policy and lawmakers to ensure that the standards of care are improved for all, absolutely for all. Universal access has to mean universal access to health care of quality with high standards of quality, implying respect and dignity. We need advocacy by international and local organizations, and we need to have the community involved telling the healthcare teams, the healthcare force, how the treatment can be improved. And we need to continue promoting a culture of respect. And I think these type of conferences are intended to do that. So let us remember that the hands that should give comfort, and I'm not talking only about the hands of the nurses, dentists, physicians, psychologists. I'm talking also about the hands of receptionists and the pharmacists, the guards at the entrance of the services should never hurt or cause harm. Thank you very much. Thank you for having me, and I hope these few words, these few reflections may serve for us to make a little contribution to change our world. And let us keep talking about, keep talking and thinking about the healing power of love. Thank you.